Pleased to be joined today by Nigel Goldenfeld, the director of the NASA Astrobiology Institute for Universal Biology, leader of the Biocomplexity Group at the Institute for Genomic Biology, and a professor at the University of Illinois Urbana-Champaign. Sergey Maslov, UIUC professor of bioengineering, who is also at the Institute for Genomic Biology, as well as the National Center for Supercomputing Applications. Dr. Toyin Adeyemi, an infectious disease expert with decades of experience at Cook County Health, where she directed the core hepatitis clinic and was senior director of HIV services for the health system. Brad Cole, executive director of the Illinois Municipal League, and Cameron Mock, the chief of staff to the Governor's Office of Management and Budget. Professors Goldenfeld and Maslov are here representing the entire modeling group that I convened weeks ago, the members of which have been dedicated to developing the best possible modeling and analysis for Illinois' battle with COVID-19. These are some of the best experts in the entire nation, and we are very lucky to have them advising us. To start, let me explain a bit about the role of modeling in my decision-making. Since the outbreak of COVID-19, I've taken into consideration a variety of models from researchers all across the world. There are often widely different projections from those about the state of Illinois. Some of this disparity is the result of methodological differences, but much of it also is due to data access and quality. The earliest coronavirus models that we had in the United States had to rely upon data from other countries applied to our national landscape. And certainly there was a real benefit in those very early days of getting educated estimates of what the virus's effect on Illinois would look like, regardless of where that early data came from. But the picture that gets painted by modeling gets better when it's based off of what's actually happening on the ground in Illinois, data that can only be gathered with the passage of time. We now have what we didn't have 2 months ago, an understanding of what COVID-19 cases, deaths, hospitalizations, ventilator and ICU usage look like every day in Illinois. Even so, 2 months is not a lot of time in the world of modeling. That's important because the very essence of a model is that it gets smarter over time. How? Well, you consistently test past predictions against current reality and then adjust projections accordingly. Or, to put it simply, the more facts that you have, like exactly how many people went into the hospital with COVID-19 on a certain date, the better your ability to predict outcomes on any later date. Notice I say it becomes better because it never is exact. There is no crystal ball available to us. There are only estimates. Illinois is the proud home to some of the finest researchers and research institutions in the world. And still, it is always the case that different modeling teams come to different conclusions. So I undertook a project to give me the best possible approximations of future COVID-19 illnesses in Illinois that would then allow me to make decisions about what resources we would need to keep Illinoisans alive and recovering, and what urgency would be required in decisions about whether to initiate new mitigation strategies or extend existing ones like the stay-at-home order. I have known from the start that even the best projections are going to have a great deal of variance, but knowing the boundaries of that variance informs my decision-making. So we convened top researchers from the University of Illinois Urbana-Champaign, the Chicago and Illinois Departments of Public Health, Northwestern School of Medicine, the University of Chicago, and we also brought in outside consulting groups. They worked as a cohort under Civis Analytics, using the most comprehensive data available for the entire state of Illinois. Suffice to say, the findings we're discussing today about the state of Illinois were put together by some of the best scientists, doctors, researchers from some of those great institutions that I just mentioned. I want to look first at the projected fatalities. As you can see from the graphs that are next to me, Illinois is now looking at a peak or plateau of deaths per day somewhere between late April and early May. Why a range instead of an exact date? Well, everyone wants to look at the median line as a guide, that nice clear line that cuts through the big shaded section on all the models circulating online. But reality is not quite so simple. Look at the actual deaths from the past few weeks on the graph next to me and look at the median projections going forward. Reality swings up and down, sometimes drastically, a fact that can't be captured with a simple median line. What we have to consider is the whole shaded area. That shaded area shows the range that researchers are 95% confident that things will land. That's a shaded area you would see in differing shapes on every model. To be clear, the fact that the variance is large doesn't make a model less useful, but it does nevertheless make it clear that it is only a tool to be used. I worry that people think the model is some miraculously accurate view into the future that is going to tell us exactly what we need to do and when. It's not. It won't. I guarantee that the model that we're sharing today will change in the coming days as projected numbers about those days are replaced with actual numbers. A model is an imperfect tool that we use to add context to the actual numbers that we can chart every day: cases, fatalities, hospitalizations, positive test results, ventilator and ICU usage. I also want to explain a bit about this change in our estimated peak cases. The concept of flattening the curve only just entered our common vocabulary in the last few months, and it's really crucial to understand our approach. Weeks ago, many models, both those produced by our in-state experts and those from around the nation, predicted an early or mid-April peak for Illinois. But as the weeks have progressed, those models have come to look quite different. That's not because those models were bad models. Instead, it's because their inputs got better as time went on. Real-time data came in, and importantly, Illinoisans protected each other by staying home. Human behavior is exceptionally difficult to measure and even harder to predict. So that last part about staying home has made all the difference in our progress. Also, and this is very important, the most sensible and responsible use of a model in a public health crisis like this one is to pay close attention to the worst case scenario. In other words, when building hospital beds, purchasing and acquiring PPE and ventilators, and making decisions about mitigation efforts, public officials should assume that the worst end of the model range could happen and take that into account in planning. A pushing out of our estimated peak is a natural consequence of, it's a natural consequence. Pushing out that peak is a natural consequence, and the best indicator that we are flattening the curve. That's what you're aiming to do, slow down the rate of transmission, which leads to a slower rate of increase over a longer period of time, hence a later and lower peak. Pushing the peak further down the line might not sound like good news, but I promise you, it saves lives. And make no mistake, Illinois has saved lives. By staying home and social distancing, we have kept our infection and death rates for the months of March and April thousands below the rates projected had we not implemented those mitigation strategies. The good people of this state have allowed our healthcare professionals the ability to treat patients to the best of their ability without having to make dark choices, very real choices that doctors in other countries faced about who lives and who dies. That is a historic and heroic act carried out by all of you. Your efforts to protect your families, protect your communities, protect each other have also given us another tool, and that's time. Time to build up our hospital capacity in terms of beds, ventilators, and healthcare workers. Time to prepare for the kind of surge that could occur any time as a result of a virus from which no one is immune. And capacity we built. In August of 2019, back in a world that had never heard of COVID-19, Illinois had an average of about 26,000 total hospital beds available. As of today, our total bed count in existing hospitals is more than 31,000. Back in August, we had about 2,000 ventilators. That number is now more than 3,200 ventilators. And we're building our healthcare workforce too. There are now 5,000 out of state and former medical professionals who have applied for temporary licenses to join Illinois' fight against COVID-19. We've built up our hospital capacity significantly. But if we let up now, we would have nowhere near the kind of hospital capacity that we would need. The projections are clear. If we lifted the stay-at-home order tomorrow, we would see our deaths per day shoot into the thousands by the end of May, and that would last well into the summer. Our hospitals would be full, and very sick people would have nowhere to go. People who otherwise might have won their fight against COVID would die because we wouldn't be able to help them through. No amount of political pressure would ever make me allow such a scenario for our state, our beloved state of Illinois. So the numbers present us with only one choice. Next week, I intend to sign an extension of our stay-at-home order with some modifications through Saturday, May 30th. To everyone listening, we are in possibly the most difficult part of this journey. I know how badly we all want our normal lives back. Believe me, if I could make that happen right now, I would. But this is the part where we have to dig in, and we have to understand that the sacrifices that we've made as a state to avoid a worst-case scenario are working, and we need to keep going a little while longer to finish the job. On a more optimistic note, my team and I are finalizing the next step principles for safely moving toward reopening in phases. We are making progress building out testing and launching our contact tracing initiative. So that is so important to us that over time we will be able to realize the new normal, and we can be ready. We'll be sharing more on that in the days and weeks ahead. On another optimistic note, May will look somewhat different than March and April. Since implementing our original stay-at-home order, I've listened to Illinoisans across the state and elected officials of both parties and business leaders, and I've continued to consult with doctors and scientists and experts here in Illinois and across the world on how best to keep our people safe. My intention, as always, is to put your health and safety first as we make some practical adjustments based on what we've learned in the first 5 weeks of the stay-at-home order. The new and modified executive order will take effect on May 1st, and I want to lay out some of the changes that we've made for you now. Because we are bending the curve, surgery centers and hospitals will be able to begin scheduling surgeries that had been delayed so that we could maximize statewide capacity for COVID patients. Facilities will need to meet specific criteria, including proper PPE, ensuring enough overall bed and ICU availability, and testing of elective surgery patients to ensure COVID-19 negative status. The Illinois Department of Public Health is issuing exact specifications to healthcare facilities statewide, based on the idea that we need to make sure we have surge capacity. We're allowing some elective procedures to resume for the benefit of patients and our hospital systems, but make no mistake, the first priority for our healthcare system continues to be the health and safety of all Illinois residents. That means preserving bed capacity for COVID patients no matter where they come from. As I've said before, we value all lives equally, and that includes the men and women in our corrections facilities. If we find out that hospitals are refusing to live up to their obligations, the director of the Department of Public Health has the authority to investigate and enforce this policy and will not hesitate to do so. Also, starting on May 1, retail stores that are not currently on the list of essential businesses may take orders online and over the phone and offer pickup and delivery. We've made it more explicit that greenhouses and garden centers may remain open with specified social distancing measures in place. We will begin a phased reopening of some of our state parks under the guidance of the Department of Natural Resources for activities such as hiking and fishing and boating with no more than 2 people. Social distancing must be maintained in all activities. We're also strengthening some of the public health measures in the order to limit the spread of the virus as much as possible. Starting on May 1, any individual over the age of 2 and able to medically tolerate a face covering or mask will be required to wear one when in a public place where they can't maintain a 6-foot social distance. Face coverings work, and we need all Illinoisans to do their part here. For our essential businesses, including manufacturers, we're issuing new requirements on social distancing and new caps on occupancy. Again, all of these things won't take effect until May 1, a week from tomorrow. And they are only minor modifications, what we can do safely, while keeping our stay-at-home restrictions in place as we manage through this next phase. I know that even with these changes, this stay-at-home order leaves many restrictions in place. And in the coming weeks, as we get to the point of working our way down to the other side of the peak, as we move forward, there will be more to do to get people back to work and open up even more. Understand that these are not choices that are made arbitrarily. These changes are what the data says that we can offer the people of Illinois without risking so much viral transmission that our hospitals will again become or potentially become overrun. That said, if we start to see crowds and people violating the order or breaking the rules, I will need to bring back these restrictions. I'm hopeful that we will not need to do that. Folks, this is a battle that you never asked to fight. I know that. I also know that our doctors and our nurses and our healthcare professionals never asked to lead us through a pandemic. Our essential workers never asked to man the front lines of society. Our small businesses never asked to sacrifice their bottom line to an invisible enemy. I see your pain, and I am so very sorry for it. But for every person who wants to go to dinner or hang out with friends in a park or swing open their salon doors, there is a family mourning the death of someone they love. There is a parent, a child, a friend who would give anything to have their greatest strain be the difficulties of staying home and not the unimaginable pain of a life lost too soon. I'm not in the business of comparing suffering. In a pandemic, everyone is allowed to hurt. But we have the opportunity to prevent the pain of loss from touching the lives of thousands. We have the opportunity to follow the leadership of the countless nonprofits and community leaders and families across Illinois who have demonstrated their courage and their empathy and their willingness to help. Illinois has the best people in the world, and I've said all along that I will fight like hell for you. I'm asking you to hold on for just a little while longer to help make sure that we all see through to the other side of this struggle. One day I pray that this virus will be a memory, but the strength that we found together will be something that we carry with us forever.